Thanks, Shavik. For the session on one very important aspect of diagnostic, and which especially we saw the transformation and importance of this sector in the last couple of years during the pandemic. This is on diagnostic. So for the session, I would like to invite the panelists on stage. It gives me immense pleasure to invite Professor Dr. Abhay Chowdhary, Professor and Head of Microbiology, Dhirubhai Patil University, School of Medicine, Hospital and Research Center. Can we have Dr. Chowdhary? Welcome. Next, I'd like to invite Dr. Aruna Poojary, Head of Department Pathology and Microbiology at Bridge Candy Hospital Trust. Dr. Poojary. Next, I would like to welcome Dr. Barnali Das, Consultant Laboratory Medicine, Kokilaben, Dhirubhai, Ambani Hospital. Welcome, Dr. Barnali. I think I'll prefer from here. Okay, so as I mentioned, while diagnostics has always been there, but in the last couple of years during the pandemic, we have seen a paradigm change in how diagnostics has been looked after and, if I may say, implemented and deployed on the ground in India. Three aspects which in this discussion would like to focus. One, integration of different components, the apps, the QR codes, online reporting, and how all technology helped in integrating all of these. We would like to talk more on the lot of these sample collection from homes. How technology helped in this respect. And the third was ultimately, if the right report doesn't reach the patient on time, the whole purpose of digitization of diagnostic gets lost. So how that has helped, and though I know all three of you are representing hospitals, but I would like to understand, even from your experience, there are diagnostic chains separately, independent diagnostic centers, and diagnostic connected with the hospitals. Are there any fundamental dynamic differences, especially in the last couple of years, when a lot of these COVID sample collection has been happening in such a large extent? So have you seen any change between the two? So I'd like to start with Dr. Chowdhary. My first question is integrating these different components. How has been the challenge and how successfully it has been done?
Namaskar. Namaskar. There are definite advantages, or what we could call it as a spin-off of the pandemic which has occurred, and really a devastating pandemic. It has taught lesson to people across the board, poor, rich, in countries which are poor countries and rich countries, everywhere. It's a pandemic in true sense. And that has taken by surprise, although we were not, the world was not really ready, but then some efforts were there in all the fields, connecting dots was required, and it happened. So although we say that how is the response is satisfactory. It could have been definitely better if we are better prepared, or we continue to be prepared. So preparedness is the key. Last few years ago, we had swine flu, then we had this pandemic. And there are a couple of people, if you go through the literature around or the information that is going around, you'll find that across the world there are people who are trying to get advantage of the research that is there. So the gain of function research is one such area where people are trying to have research for their personal gains or gains of individuals. Barring those efforts, I would definitely say that this pandemic has definitely united people, definitely connected the dots, and we have used those technologies, digital technologies in particular, to the advantage in patient care, in surveillance activities, in diagnostic activities individually. It has helped in epidemiological surveillance. It has helped in monitoring the pandemic. It has helped in other than health sectors also, like how we are going to have the lockdown and no lockdown, the restriction of movements, the travel related restrictions, all those. And suddenly the technology has helped in terms of the digital technology in communicating with other sectors. So that if someone is having a diagnosis or a disease or an infection, then it would definitely be communicated across, so that there is rather restriction on the movements of people concerned in the form of smaller lockdowns or bigger lockdowns or whatever it is. This has been possible because of rapid diagnostics, what we say point of care testing, the standardization of technologies. Particularly, you'll find that in terms of the availability, many medical colleges were compulsorily made to be prepared for molecular testing. And this has definitely boosted across the country in terms of the technology which has been made. Although there are definitely additions with the private sector also, new technologies have been added, all this has been standardized, and this is definitely a positive way of looking at it, that this has helped. Definitely it is going to be more and more as we move on. I think you can have some.
Yeah. Dr. Aruna, this integration we are talking about, how successful it has been and what were the challenges that you faced?
Um, meaning initially, certainly there was such an overwhelming amount of samples and tests and how to interpret them. So I think everybody was confused about how to interpret a test, what sample to be taken, when is it to be taken, how many times it is to be taken. And all of that initially created so much of confusion and panic. And in fact, as we went on, things settled down a bit because there were better guidelines that were put forward. The testing also was streamlined. We had more availability of tests. As Sir said, medical colleges were made to, improvise and made to have facilities where PCR testing could be done. So PCR testing, I must inform the audience, that is not something which was, a simple way to test. It was always supposed to be a high-end kind of a testing, a very specialized setup requiring testing. And suddenly with the pandemic, all these things changed. Many more laboratories, even the smaller ones, got capacity to actually perform PCR testing, and they were all NABL accredited. So I think that was definitely a very big task that happened. So the moment NABL comes in, there is assurance, there is quality, there is standard that is there. So I think, initially maybe we were confused, overwhelmed. Of course, the peaks always overwhelmed us. The laboratories were always overwhelmed during the peak times. But we took it in our stride, and I think we've moved ahead, and we are preparing for the future.
Okay, thank you. Dr. Barnali, this standardization, how long it took? Because that's where the critical thing is. So how long did it take, and what were the challenges that you faced on the way?
Yes, the first, like Dr. Chowdhary and Dr. Aruna said, the health equity is major challenge in India. We face, prior to COVID, we can say prior COVID era, and maybe we are going towards COVID, post-COVID. So before that, technology, if you tell digitalization, IoT, artificial intelligence, machine learning, deep learning, were very these words were not very familiar to us, the healthcare or diagnostic industry. But what we understood during this COVID time, that we realized the role of how clinical decision support, how all this implementation of IoT or AI or machine learning or deep learning based neural network or algorithm or model, how it can transform our life. Is how remote monitoring is possible. Someone maybe during the initial time we realized, like, we are in Mumbai, we are doing our RT-PCR, but someone from Leh want to start that accreditation and want to start this process. So to help them by remote monitoring, the health equity has actually transformed. Like, with this digital transformation has made social transformation. Like, this is the main, like, roadmap. Even now we don't know the roadmap. Maybe another wave will come, or maybe that we are going towards post-COVID era. But we realize that we are able to overcome this. Although initially it was overwhelming, second wave was overwhelming, but we realized that we are not now working in silos. Initially, all of us, like diagnostic sector working in silos, then clinicians working in silos, IVD manufacturer working in silos, the Dell and other technology like Intel and all those platforms, they were working in silos. And even the accreditations, like Dr. Aruna said about NABL, College of American Pathologists, ICMR, all of us were not integrated, or there were no collaborative approach. So we were really overwhelmed. But now this pandemic taught us how to integrate all the stakeholders. And now we are the main challenge which were there, that we were working in silos. So we are working together, and we want to develop strong support system for to face any pandemic in future.
Okay, thank you. Yes, sure.
Now, here the challenge was not only diagnosis. Diagnosis was one important aspect of it, but as the disease progression, the monitoring of the disease progression, that also was an important issue, and that was successfully tackled through the technologies, the digital technologies which were added. In addition to that, when the vaccine came in, now really is it effective or not? There are different types, and then this was really initially as a chaotic situation, as what is about neutralizing antibodies and whether it is going to protect, or what is the titer, and people started talking about it. The lay people talking about RT-PCR, lay people talking about what is your number, what is the level of your antibodies, how long you are going to. So this is something which, and then people started talking about the variants of virus and all. So people in general are so much educated with the social media that they become, we wonder, there are so many virologists in the country, as a social virologist also. So this is something which is a negative side of that propaganda.
In my hospital, and I were to add his data, I get that data, the previous data, I am able to access that. That's really good. So people will eventually realize that centralizing this kind of, digitization of reports is going to help them, rather than, carry through heavy files eventually. I'm sure, I'm very optimistic about that.
But what about, here you are talking about, since you will be collecting and maintaining that data, the issue of privacy and sanctity of that data, how would you,
Yes, certainly.
security
I
of
think
that data also?
that's something which is very, very important to us, and most of the developed world have very strict data privacy laws, and the previous panel was also discussing this. I think I'm not an expert, but this is naturally a matter of concern. I don't want any of my signed reports to be figuring out on Google. I've seen that and been very, very worried and concerned. So that's certainly an issue that probably our technology partners need to support us with.
Sure.
But
I think tomorrow, like open source API and all, like everyone is going for. So with open source API and with help of the digital technology partner, I think we are going to, although data security is a problem, but innovation comes with certain regulations, but with many regulations prevent innovation. So, so self-regulation is the key. So when we have lot of high velocity data, so implementation of that data in proper way or open source API will actually is the need of the hour. Like that can really help the diagnostic sector and healthcare sector.
So, for the overall diagnostic sector, if we do a little bit of crystal ball gazing, what do you think? See, we might be in a post-COVID phase, and this might not occur to that extent again, like the first and second wave. But there can be other infectious diseases, and similar situations might arise. In that, keeping in mind that context, and if we do a little bit of crystal ball gazing, what will be the way you would like the diagnostic sector to shape up in the future, and what would be the priority focus areas?
Dr. Chowdhary and Dr. Aruna will be the will better answer, but we have seen during the pandemic like mathematical modeling, like
Yes.
SAR model and Sutra model, if you say pandemic models, that really helped, especially Sutra model, if you say, that have helped us all those predictive model, and like South Africa when there was surge, so they have predicted with those kind of models. So pandemic models really helped us, and in future also, I think Dr. Aruna and Dr. Chowdhary will share more insights into this.
Sure.
See, this kind of fear is the key. If you go in the past 3 to 4 decades, all the new emerging and re-emerging infections have been of almost 70% are zoonotic origin, and they are viral etiology. So it is a viral zoonosis which is coming from animals and human beings. And we need to be very, very good about understanding what are the interfaces which are likely to be there. And in addition to that, there are people who are trying to, mislead or get undue advantage of their preparedness or little ahead of the world about the technologies and trying to misuse them. So this is something which is, really fearful. But if we go by the response of Indian, or rather Oriental population, I would say, the Eastern world and the Western world, you'll definitely find that the traditional ways of health, about the sanitation, definitely have helped in them. Although it is very bold statement, I would say, but because there are no authentic reports or what we'd say evidence-based statements. But these are the things which speak for them. You talk about outcome-based, and then definitely these are the speculations or these are the reasonings by which it could be there. So we have something which we have to improve on things as a social group. Individually, we want to be very clean and all that, but socially also we need to have some more etiquettes developed and some more standard practices to be used so as to avoid respiratory. Now, the new possible developments or the biological warfare into inverted commas, I would put it, that this is something which we have to be aware of. And we have to be really vigilant about the things which are there. Now, what do we do as a routine? As a routine, we follow the practices which are healthy practices, traditional practices, as we see. That is one part. Secondly, maintain the health. Healthy person, as a preventive measure, my teacher is here. He would also, he's been telling, health promotion is the most important activity. And we neglect that. So health promotion, if it is being achieved, well, we take care of it. We have those traditional knowledge. We have to make use of it. And definitely the new modern technology, the digital, the AI and all those things are definitely going to aid or add to our advantage.
So I think what in future, what needs to be done is definitely, predictive statistical modeling needs to be strengthened. In fact, it's not only to do with re-emerging zoonotic infections, as sir has said. A lot of other pandemics are currently going on, and I'd like to draw the attention of the House to another pandemic that in fact we are sitting on, that is antimicrobial resistance. And fresh data which was recently published in the Lancet has through predictive modeling has got data from areas where there is absolutely no data, and they said that almost 1.27 million people died in 2019 because of AMR, that is antimicrobial resistance. So we'll have to really strongly build on statistical predictive modeling. That the second thing is, I think we need multidisciplinary research and collaboration. I think at least India, we grossly lack on that. There is no dearth of probably mind and money. I don't believe it. There is no dearth of mind and money, and yet this mind and money don't seem to be coming together to collaborate, whether it's clinical, whether it's academia, whether it's industry. Why can't the mind be supported to develop something which is a POC and will be used by a whole lot of masses? So I think these two are key. We need to collaborate and invest in research. The previous panel talked about, Dr. Malik, I think, talked about investing back into research, and I think we are not investing enough in research. If we don't do that, we are not going to look forward and ever be prepared for another pandemic or any kind of disaster that's awaiting us in the coming years. So these are two important points that we need to take care of.
Okay.
Absolutely. Here, like, I want to acknowledge, like, when we started our projects with IIT Bombay, KCDH, so we realized, like, role of digital technology, how it can transform our data, like, with those high velocity data, maybe 12 billion data, how, like, that can transform into, like, electronic medical record or alert. Like, we did some project with AKI alert, acute kidney injury, and we realized how it can transform, and there is paradigm shift in understanding the data and utilization. Data utilization is very important, and for that we need collaboration.
Keeping this collaboration thing in mind, I'll go to a question which is less of technology, more of business aspect of it. One, again, you are representing hospitals here, but we talked about a lot of these large chains of diagnostic centers across the country, and often they are doing humans work, especially in remote areas. So collaboration, when we are concerned, how successfully can there be a collaboration in business models of the hospitals and these third-party diagnostic centers? That is one. And another challenging aspect, what we have seen recently, is a lot of these apps are coming up, and they tie up with the diagnostic centers, and often there are, I don't know, but they look, recently there has been one of these apps talking about you can do the testing anywhere, and they are showing in anywhere, literally meaning anywhere. So how is the, if I may say, the medical integrity of such claims, and how can the diagnostic centers work with these apps? So yes, sir, if you can.
Yeah, as it has been mentioned earlier also, the standardization or accreditation is the key. There are hundreds and thousands of labs, individuals, qualified pathologists, microbiologists, biochemists, and there are technical people, technicians rather, opening up the things and all that. So this needs to be really standardized, and standardized in the sense that, okay, it doesn't come overnight. It has to be with proper regulations, curtailed, and then they can be networked together. So it is not only the availability of any lab, but a standard lab. So only when these standard labs or the accredited labs network, then only there is authenticity, there is reliability, there is all additional things which we would say that they are good lab practices which are being followed there, and the results that will come. It is like garbage in and garbage out. If you are using third-rate methods, if you are not collecting the things properly, whatever the results are going, they cannot be reliable. So it is that is the key. And this is the reliability will come only when there is a third party accreditation, like in NABL. So definitely 20 years down the line, if you see hardly 10 labs were there. Now we see more than 1,000 labs are there which are accredited. So whether it is a collection center or a full-fledged lab, if they are under accreditation by third parties, definitely this is a base or foundation on which we can build reliable networks for healthcare in diagnostic sector. And this is always going to be adjunct, but a reliable system wherein this would be going. And if this is so, then over a period of time with electronic records which are there, you can have your own record how you are doing better in terms of health, or it is going to be worsening. So all these things, or it is stable, all these things are possible only when you are comparing. So such apps are also going to be useful, which will correlate or which will have that linkage of your own reports 10 years before, 5 years before, and today. So that is how periodically you can judge the decline or betterment in your own health.
Exactly, a revolutionary idea that you are talking. Yes, Dr. Aruna?
So I think it concerns me to see so many widespread apps, sprouting out, and really it concerns me with respect to the quality that you also raised a concern about. And unless they are really, networked with accredited labs, as Sir has said, there is a problem. But from this, meaning why have these come out is also an important thing for us to kind of ponder or, think about. There is need for us to penetrate into, the far and wide sections. So that need is going to probably in future, develop into a better system. So while this concerns me now, I'm hoping that in future, as institutions or maybe even standalone laboratories, we will be able to address this issue by collaborating with technology and trying to reach to the farthest. I think that's what is the key, access to diagnostics for everyone.
That's, yes, democratization of, yes, Dr.
Yes,
Barnali.
this app has pros and cons, as Sir and Madam mentioned. Like we realize, I am part of a COVID task force, international and national. So we realized during the second wave, how this access to remotest area, or like I was communicating with someone in Tripura. I was Tripura, so that healthcare access, even the resource or supply chain management. So how it is important. Like we may be working in certain lab or hospital, but sometimes during this kind of situation, we all become together as a society. As like I told, digital transformation during the pandemic is social transformation.
Exactly.
So actually during the being in the task force, I realized how everyone, it's not like only the medical fraternity, all the fraternity, how came together, and this collaborative approach helped a lot for this health equity and health access.
I just want to know how many of you who are here, when there is a call or when they ask for, okay, you would like to go for health checkup or the lab reports, etc., we insist on it as whether it is a NABL accredited lab or not. Or we go by the values which are mentioned, 1,000 rupees and 75 tests, 84 tests and all that. Do we really check whether it is accredited lab or not? Because it matters very much. Accredited lab charging for say 1,500 and non-accredited giving 1,000 rupees. Now, where is the basis for belief? How do we get that into real values?
Exactly. So, in fact, to sum it up, the discussion, this accreditation of all the labs and the standardization, so that the accreditation obviously gives a sort of sanctity to the whole process, and standardization is definitely required. Then we talked about the social transformation accompanying the digital transformation, and then obviously that even the standalone third-party diagnostic centers have also done human service by reaching up to the hinterlands and stuff. So great. For paucity of time, we can't continue with this discussion. Very interesting point. So before we conclude, I'd like to invite Ms. Shangamitra Mohanty, co-founder of APAC News Network, to hand over the leadership recognition to the panelists here. Dr. Aruna. Dr. Barnali. So for the next session, I'd like to